Hello again, everyone. My name is Amanda Mortimer, and I'm back to discuss diabetes or gestational diabetes and its effects on the mother and the fetus or the neonate. So, of course, we have type 1 diabetes, type 2 diabetes, and gestational diabetes. So, with type 1 diabetes, it's insulin dependent because of insulin deficiency in the body, and it's usually due to an autoimmune process. People are oftentimes born with it. Type 2 diabetes is when there is insulin resistance or deficiency in which the body has issues with regulating and using the glucose as fuel. This usually is related to obesity or sedentary lifestyle, poor diet. There's many different risk factors for it. These health conditions can be present in the mom before she becomes pregnant. And of course, she'll have them throughout the pregnancy. Once you have it for life. Or there's also the risk of the mother becoming diagnosed with gestational diabetes, which is where the blood sugar levels become dangerously high during the pregnancy, and it's usually due to glucose intolerance. Gestational diabetes, they're not actually sure what causes it. There's still ongoing research for it, but it's oftentimes because the body creates hormones and goes through changes such as weight gain, resulting in the body's cells to use less insulin effectively, and that results in insulin resistance. Gestational diabetes may oftentimes not cause any noticeable signs or symptoms. So in this case, that's why it's very important for mom to be tested, especially around its onset, like 24 to 28 weeks of gestation. And most importantly, I feel like just right from the get-go in the beginning. Gestational diabetes can have many effects on both mom and baby if it's not treated with strict adherence, or just, nothing is done about it. First and foremost, the effects on the mother can include hydramnios, if I'm saying that right. And that's where too much amniotic fluid just builds up due to fetal diuresis, where baby is just basically peeing too much. And that's a result of hyperglycemia. The hyperglycemia can also cause the mother to go in ketoacidosis, of course, and the mother may present with symptoms such as just feeling like general fatigue. She might be nauseous. She might have unexplained weight loss, or she may experience or show Kussmaul breathing. And lastly, one of the telltale signs of ketoacidosis, she could have a fruity odor present on her breath. You may also see the mother's blood pressure increasing. So then now she has gestational hypertension. The amniotic sac may break open before labor begins, which is also known as PROM. PROM is the acronym, which stands for premature rupture of the membranes. And this can cause the baby to be born prematurely. And we all know, like, if a baby is born prematurely, it really depends on what weeks of gestation they're at, because if they're born many weeks before, they may not be fully developed and can have a number of ongoing issues with that, and may need to remain hospitalized until they do develop fully, or just to be monitored overall. Mom may also experience glucosuria, and that's just where there's too much glucose in the urine, and when she has too much glucose in the urine, she may have frequent UTIs, urinary tract infections, or she might have chronic monoleal vaginitis. And that's because the glucosuria promotes the growth of yeast. So now the yeast is out of control. Mom may also experience other complications if the glucose is to remain high or uncontrolled, and this of course can include stillbirth. It's very sad. The need for a C-section, like an emergency one. This could also be because of a difficult labor, or one of the, I feel is very alarming, is a postpartum hemorrhage. And that's basically where mom just kind of, like bleeds out after she gives birth. And that's because the uterus has become over distended. The uterus has become so large because it had to accommodate an infant that was much larger than average. Sorry. There are many effects on the neonate or the fetus, and this can include cord prolapse, and that's where the umbilical cord, basically when baby's coming out head first, the umbilical cord slips up and around the baby's head, and after the water's broken, it comes through the open cervix. The baby may also present with many congenital abnormalities that include cardiac issues. They could have neural tube defects. They could have genitourinary problems, or even skeletal deformities. As said before, the baby may become larger than average, which is also known as macrosomia. And this can result in birth trauma, such as shoulder dystocia. And that's where one or both of the shoulders basically become stuck or caught above the mother's pubic bone, and the baby's head is retracted into the vagina. So you basically, when I looked it up, you have to picture it as a turtle retracting its head into the shell. So you'll see like the baby's head come out, and then all of a sudden it retracts. And that's because baby is so big, they can't move past that pubic bone. Preterm birth can also take place, and as I said before, depending on the weeks of gestation, the baby may not have fully developed, or fetal asphyxiation due to fetal hyperglycemia or hyperinsulinemia. Placental perfusion can be greatly impacted, and it can decrease, and that results in the fetus not to grow as expected, or where the fetus does not receive adequate amounts of oxygen, resulting in perinatal death. Gestational diabetes may also inhibit phospholipid production, which phospholipid makes up surfactant. And basically, if the surfactant is messed with, the fetus can experience respiratory distress syndrome. The fetus can have an increase in red blood cells, and the blood can become thicker, putting it at more risk for blood clots as a response to hypoxia. Baby may also be born and appear yellow or jaundiced, and you would see that, of course, with the eyes and the skin, and that's a result of hyperbilirubinemia, and that's because of the excess and the breakdown of the red blood cells, and because the baby's liver is immature and not able to basically do its job yet. Lastly, the baby will be more at risk for childhood obesity and carbohydrate intolerance as they get older. And basically, just gestational diabetes outcomes have been improving over the years. However, it still remains a high-risk condition during pregnancy. It's probably one of the most common high-risk conditions. My sister actually had it when she was pregnant with my niece, and she had to have an emergency C-section. Not only that, her blood pressure was sky high, heart rate was all over the place too, and they basically all accounted that for her gestational diabetes. 'Cause, 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 'c basically, it's just very important for mother to be screened for it. That's one of the most preventative methods, and that's how everything can have a good outcome for the baby. Oftentimes, in order for mom to have a good outcome with gestational diabetes, there should be like strict adherence to treatment, basically, frequent prenatal visits. Moms should be monitoring their blood glucose all the time. They should have frequent laboratory tests of their blood glucose. Also, other laboratory tests that pertain to that. She might also want to be compliant with any dietary restrictions. She may need to have fetal surveillance, or she may also need to be hospitalized to closely monitor her and the fetus or for treatment. So there is good outcome with it as long as mom has strict adherence to this. And that's all I have to say. Thank you.